Despite the county seeing fewer positive COVID tests, county health officials are seeing a rise in COVID deaths.
This comes as hospitals are seeing patients staying longer and some moving into the ICU. CBS 8's Heather Hope spoke to two local doctors about this trend.
San Diego County COVID case rates and testing rates have been dropping week to week, but the number of COVID hospitalizations is on the rise, reaching 80% hospital capacity, and those in the ICU has been up by 15%.
We know that cases rise, and 2 or 3 weeks later, we start to see hospitalizations rise, and typically right around peak or after the peak of hospitalizations, we begin to see critical care numbers rise.
UCSD Chief Medical Officer Chris Longhurst says this trend has come up throughout the COVID pandemic, where it typically takes people a week or two after being infected to require hospitalization and impact those numbers.
So those people who got sick, early or at the peak are just now coming to the hospital requiring oxygen. And typically it's after that hospitalization surge that some of the sickest in the hospital begin to require intensive care.
A UCSD testing chart shows how severe the Omicron surge has been compared to cases at the start of the pandemic. Longhurst says although numbers are dropping, they are still high.
So as we come down this Omicron surge, there's still hundreds or thousands of people who will be infected in the coming weeks.
Scripps Health yesterday had 278 total COVID patients, with 51 in the ICU, which dropped today to 265 total COVID patients with 48 in the ICU. Sharp Healthcare saw a decline from 448 COVID patients last Friday with 73 in the ICU to 410 total patients today with 67 in the ICU. Kaiser Permanente San Diego says its COVID cases are also seeing a gradual drop.
Hospitalization rates are coming down and ICU are coming down as well.
Kaiser Dr. Will Sang says don't expect the hospital numbers to drop as fast as they increased, as some patients are remaining in the ICU for nearly 30 days.
It took about a month to get up there. It's going to take about a month for the case rates to come down, but the hospitalization rate will drag on for another 2 weeks or so.
But on the rise is the county's COVID death toll. Kaiser Dr. Will Sang says don't expect these alarming numbers to drop as fast as they increase.